Joining us now is Rimoin, a professor in the Department of Epidemiology at the UCLA Fielding School of Public Health. Great to have you with us.
It's nice to be here.
So let's start with this new version of the Omicron variant called BA.2. It's showing up in nearly 50 countries, including the US, and is apparently more contagious but less severe than the original Omicron variant. So what more are you learning about this, and how concerned should we all be?
Well, it's not surprising that we're starting to see another variant arise and to start taking over. This variant appears to be more contagious than the original variant of Omicron, but right now we still don't know enough about severity to truly understand it. It appears not to be any more severe than the original Omicron strain, but I think that we have to remember that this increased transmissibility does lead to more cases. More cases does lead to more hospitalizations and inevitably more deaths.
Yeah, sadly so. And of course, we are also seeing a steep decline in COVID cases across the US, with some experts suggesting this is the most optimistic sign they've seen in a long time. Do you agree with that assessment? And when do you think we'll see an end to this pandemic?
Well, Rosemary, I am very heartened by seeing this collapse in the number of cases. It means that we're going to be over this surge probably in the near future, although this new variant is probably going to extend that runway a little bit longer before we get completely over this surge. But we can't lose track of the point that we're probably going to see other variants. We have not vaccinated the rest of the world. This virus mutates very quickly, and we've given it a lot of runway to do so. So we're going to get through this surge. We have to do what we haven't done in the past, which is to really keep going forward. Make sure we have adequate testing, make sure we have adequate vaccinations for all, and that we're getting as many people vaccinated, and good treatments available as well. So when and if we have a new surge, we're ready for it whenever that is.
So let's look at those vaccinations, because in the US, nearly 64% of the population is fully vaccinated with the 2 shots, but only about half of the eligible population is boosted, even though research shows that being boosted is essential to protect people from any severe illness or hospitalization. So why is that message failing to hit home for so many people, do you think?
Well, I think it's been the messaging has been very confusing to people, and I think that it's we've been learning about these vaccines as we go, and sometimes this messaging has to catch up. But the bottom line is that if you are fully vaccinated and you have not yet gotten your booster, you're going to be more at risk of getting this virus. If you get this virus, you have the opportunity to. I mean, you could to get very sick from it. We still don't understand long COVID, but more importantly, you can still pass it on to other people. And there's still a lot of very vulnerable people, including people who are immunocompromised, don't mount the kind of immune response that we like to see from these vaccines. So it's still the best thing that we can all do is still do everything we can just to reduce the spread of this virus.
And still more than 2,000 people are dying every single day from COVID here in the United States. Why is the death toll so shockingly high in this country, do you think?
There are a lot of reasons for it. First of all, we're seeing so many more infections here. We're seeing very large numbers of infections. We have also a lot of people with comorbidities here in the United States, and people who we have large pockets of people who have not yet been able to be willing to get vaccinated, and that just means that this virus has the opportunity to run rampant. We have a very diverse population here in the United States, and it's really hit populations where you have lower socioeconomic status, disadvantaged populations, the hardest here, and they've really borne the worst brunt of it. So I think it's just important for people to remember that this virus is still very dangerous and still can do a lot of damage. And we've seen so many deaths. We're going to hit that million death mark soon, and many of these deaths were very preventable. Most of them were.
Yeah, and we can't labour that point enough to get not just the 2, but the 3rd shot, the booster shot, so important. Rimoin, thank you so much for joining us, as always.
My pleasure.